Hello, hello. Yeah. uh, Good evening, everyone. Today we are going to discuss about the management of different hair loss. So basically, the causes of main hair loss, whether in the males or females, are two reasons. One is the pattern of baldness. The second one is the excessive hair shedding. These are the two other major causes for the hair loss. The pattern of baldness again is divided into two. Like the males, if it is occurs, this is called male pattern baldness. If it occurs in the females, it is called female pattern. As we see, there are a lot of people are suffering from the male pattern baldness. So again, the male pattern baldness. Next slide, please. See, this is the classification. This is the classification of different types of the male pattern baldness. These are classified from grade 1 to grade 7 or grade 8. Grade 1 means it is absolutely normal hairline. In the grade 2, you will see the surrounding here, the recession. Somewhere hairline goes inside in the both angles. It's a grade 2. And the grade 3, not only these angles, the front hairs also goes inside. So that is a grade 3. And grade 4 up to mid skull. The complete hair loss is there up to mid skull. And grade 5 up to anterior border, up to the vertex. This is called vertex, up to vertex. And grade 6 involvement of the vertex. And grade 7 behind also, in the occipital region also. Occipital region means in the back side of the scalp also, hair loss will be there. So depending on the degree of hair loss, these are be classified. So according to the degree, we can plan the management also. Suppose grade 3, grade 1 is there, grade 1 is absolutely normal. And even grade 2 is also absolutely normal. Especially the teenage people who is turning into 20, 21, 22, that time they notice this is called bitemporal recession. So they will come, they will scare and they will come for the consultation. They think that they are suffering, they are losing the more hair. But it is not like that. It is absolutely normal. So grade 2 is considered as a normal. For grade 2, no need of any treatment. Suppose if the family history of baldness is very strong from mother side or father side, and if they are presented with grade 2 and behind that is suppose hair thinning is there, then he may progress to grade 3. In such cases, then we have to start the treatment. So grade 3 onwards, if hair thinning is there, then we recommend only minoxidil lotion. And if he's above 18 years, then we will recommend finasteride, topical, oral. Depending upon the severity, if the beard growth is good and beard mustache growth is good, then we will recommend finasteride. Otherwise, we won't recommend it. We only recommend minoxidil lotion. That is in the men, either 5 or 10% daily. And he is supposed to use morning one time, night 1 ml, morning 1 ml. So if the grade 3 onwards, if they are eligible and age is about 25 or 26 years old, then we will recommend transplantation, hair transplantation also, provided his donor area is good and there is a no strong family history of the baldness. So from grade 3 onwards, like grade 3 vertex, grade 4, 5, and in up to 5. In 6 and 7, there should be enough donor area, strong, thick donor area. If it is not there in the grade 6 and 7, we won't do the transplant. Up to grade 5, if the donor area is very thick and stable, then we can take up for the hair transplantation. So this is the even after the hair transplantation also, if any thinning of hair is there over the mid skull, then we will recommend minoxidil also to continue afterwards also. Suppose in some patients rather than this type of grading, some people will have the diffuse thinning. Diffuse thinning means from front to up to mid skull, up to vertex, they have complete thinning of the hair. This is we will call female type of male pattern baldness. So in these cases, we won't recommend any transplant. We recommend only minoxidil lotion. In this in these people, if they take head bath or if they apply the hair oil, in that time they will see the gaps in between the hair is more. That is what we call see-through effect. So in such patients, in such people, yes, they have to use minoxidil lotion for life. Morning 1 ml, night 1 ml. They are supposed to apply to the scalp, not for the hair. And they have to take 1 ml of the lotion, put a drop, and spread all over the scalp. And with your fingertips, just lightly massage it. So some lot of people they have the doubt after using this minoxidil whether they want to get a hair wash daily. No need. After using minoxidil, in half an hour time it will become dry. So just before going to bed, half an hour before better to apply. So in half an hour time it will become dry. And next day, no need to take head bath. Even morning also you can apply 1 ml lotion in the morning also. And those people who have a dandruff, and after application of the minoxidil, you will develop some scaly kind of dandruff like of thing. In such cases, yes, you have to take a bath daily. You can use anti-dandruff shampoos like ketoconazole shampoo, cyclopylax. These are the medicated shampoos. Use these shampoos and take the bath so that you don't develop any dandruff and you don't develop any scaly kind of thing after the using of minoxidil lotion. So these and next slide, please. So this is in the males. On the counterpart, the females also they suffer like males. But in the males, you will see complete baldness. But the females, you won't see any complete baldness. Here, along the partition hairline, you will see thinning of hair. This thinning of hair, depending upon the width of the thinning of the hair, again, we classify it as a grade 1, grade 2, grade 3. So this first photograph is the grade 1, second photograph is grade 2, and third is grade 3. So grade 1 means is just only thinning. In these females also, we recommend to use minoxidil lotion because this sometimes grade 1 may progress to grade 2 and grade 3. To arrest or to postpone that progress, we recommend to use minoxidil lotion lifeline. And simultaneously, we recommend them to check any hormonal imbalances there. Like most commonly is polycystic ovarian disease. So if they are in the ovaries, if they have any cyst like balloon kind of things, if it is there, because of that cyst, usually ovaries produces female hormones, but male hormones is also it is produced, but it's very negligible amount. If they have this cyst and these ovaries, they produces significant amount of male hormones. That male hormones will cause the baldness in the females. So if they have the PCOD, then we will recommend to consult a endocrinologist or gland specialist. And after that, after consultation, depending upon the severity, we will recommend to take hormonal pills and sometimes spironolactone, anti-hormone, anti-androgen tablets, along with the minoxidil. Suppose the patient is in grade 2 or in the grade 3. For grade 3 patients, we will directly recommend to go for transplantation. And grade 3 patient, if there is a significant see-through effect, and that means significant thinning is there, then we will take up for transplant. And after transplant, then we will recommend to use hormonal tablet and minoxidil lotion. Also, if they are suffering from PCOD, we will recommend to use hormonal pills also. So depending upon the severity in the females, we recommend the treatment. So next slide, please. Apart from this pattern of baldness, most of the either females or males, even after COVID, they get the COVID. A lot of people nowadays they are complaining that they are losing excessive hair. Their hair is shedding. The most common complaint is wherever they go, like in the bathrooms, in the bedroom, in the bed area, pillow cover, all this are studded with hair. What could be the reason? So this is like this. If they comb the hair, you will see a lot of hair. And sometimes some people they collect all the hair and they will collect in the small polythene bag and they will get to us. So this is telogen effluvium. Why does it happens? Next slide, please. So before to know why does it happen, you should know the hair cycle. This is called hair cycle. The hair cycle, again, it has three phases. The first phase is called anagen or it's a growing phase of the hair cycle. The hair will grow for 4 to 5 years in this phase and then it will die. The second phase is called catagen or dying phase or involuting phase. In 4 to 6 weeks of time, it will die. After day, it will take some rest in the skin. That is called resting phase. Okay, this resting phase, it will last up to maximum 4 months. After that, the hair will fall. So, in normally, in a healthy individual, the anagen and growing phase will be around 80 to 85%, and the catagen phase is around 5%. That telogen phase or resting phase around 10%. So 10% hair has to fall in healthy individual. The 10% means roughly 50 to 100 hair will fall every day after taking head wash or a combing, then hair dressing, whatever it may be. So you will see 50 to hair fall is absolutely, we consider it is normal. So if you are losing more than that, that means if you are losing more than 100 hairs per day, then that is significant. So what happens if it's more than that means this anagen phase, the duration will reduce and they will turn very fastly, very quickly towards the telogen phase. So telogen percentage rather than 10%, it may increase to 20% or 25%. So that is the reason you will see excessive hair shedding. When does it happen? Suppose if you have excessive stress and if you are not taking proper food, and recently, COVID infection, we are a lot of patients are coming after post-COVID infection with hair loss. It is just because of this change of percentage. This is called telogen effluvium. Usually, it will settle down within 6 months because in this stressful condition, hair also will undergo a lot of stress. So, any stressful conditions, if you're not taking proper food, post-COVID or post-viral fever, any kind of fever, post-viral fever, and any surgery, post-surgery, any surgery, and sometimes apart from this, if you have a hemoglobin is low, it's called anemia and iron deficiency, and vitamin D3 is low, vitamin B12 is low, thyroid disorders like hyperthyroidism or hypothyroidism. Apart from this, if you are taking any medications, like some people they take some antihypertensive medication like BP medicine, and sometimes epilepsy. Epilepsy medicine can also cause hair loss. So we have to rule out what are the causes for this hair loss. Apart from that, if nothing, if no reason is there, most of the people they are suffering from the stress. If there is excessive hair loss is there, and they will get stress, and this stress also will aggravate the again hair loss. So it is like a cyclic process. So then you have to reduce your stress. So once you correct the cause of the hair loss, automatically this cycle will be corrected, and your hair loss will stop from 6 months to 1 year. Even after delivery also, this cycle will return. After delivery also, a lot of female they can notice during the pregnancy there is a very good hair growth. And immediately after delivery, up to 6 months of time, there is a lot of hair shedding will be there. That is normal process. Exactly what happens that's called telogen effluvium. And after 6 months of delivery, again the hair cycle will become back and it will be settled down. So no need to worry. So this is called telogen effluvium. But those who are suffering like excessive shedding, how to consult a doctor, and they have to know what are the causes for this excessive shedding, and according to that we can take the treatment. Next slide, please. And other problem, apart from these two major causes, one is the pattern baldness or male. The males we call male pattern baldness, in the females we call female pattern baldness. And apart from that, the second problem is this, it's called excessive hair shedding or telogen effluvium. And third hair loss problem is the alopecia areata. In Telugu, they call Pelu Kurukulu. This is actually there is a no. This is misnomer. This is a alopecia areata. It is a autoimmune disease. What happens in alopecia areata? Next slide, please. So these are the causes. Initially, in the children or in adults, they will develop the 1 rupee kind like size a glass patch. Some people they develop overnight also. So these patches sometimes they will suffer on its own automatically. So since some people they may develop number of patches and then they will increase in size, and sometimes they may develop over the eyebrows also, eyebrows, eyelash, all these things can also occur. So this is called alopecia areata. So there again is a major cause is genetical, and sometimes excessive stress, and sometimes hypothyroidism, and if they have any allergic manifestations like asthma, eczema, dust allergies, frequent sneezing, frequent cough, these people, they are more prone to develop alopecia areata. Next slide, please. Next slide, please. So this alopecia areata, what happens? This is there is a blood supply will be there for the hair follicle. In the blood supply, there is a white blood cells will be there. What does it do? If any foreign things enter into the skin or enter into the body, like any bacteria, virus, they will recognize it as a foreign, and then they will go and they will attack it and kill it. So in simple language, we will call it as a immunity. But these white blood cells are called police cells. They are mistakenly and misunderstanding that these hair cells are foreign and they are going and attacking it. So then these hair cells will die. So the process keep on going on. So the hair loss patch will increase in size. So this is called alopecia areata. Next slide, please. So this is a classical male pattern of baldness. I told you is a grade 2, grade 3, grade 4, 5, 6. You can see in some people as the age advances, the baldness also keep on increasing. Next slide, please. For these patients, this is a typical females. You can see grade 1, grade 2, grade 3. See, grade 3 we can do transplant, and grade 2 also, if there is an excessive see-through effect is there, then we can take up a transplant along with the medications. Next slide, please. Next slide. This is another type of female pattern baldness only. This is called Christmas tree pattern. And what do you do? What we do in hair transplant means you can see in the hairs which is coming from the scalp. It is not like a single hair. Sometimes 2 hairs comes together. Sometimes 3 hairs comes together. So then we will call this as a follicle. So follicles, it may contain 1 hair. It may contain 2 hairs. It may contain 3. It may contain 3 hairs also. So we will take out that follicle completely, and then we will transplant it to the bald area. Next slide, please. Again, this procedure is 2 types. This is a follicle. You can see it's 1 hair, 2 hairs, and 3 hair and 4 hair follicles. Next slide. So next slide. This is the microscope we use for transplantation. See, this is the male pattern baldness. Is almost all is a grade 5 baldness. Then we did strip technique, strip transplantation, strip hair transplantation. So this is after 1 year of the transplantation. You can see they're very good growth. It's absolutely natural. So no need of any maintenance. You can take it. You can take care like a normal hair. Next slide, please. You can see the combing of it is absolutely unrecognizable. Next slide, please. So this is a strip. In the strip, you will see the stitches. We will take out the one strip kind of completely stripped kind of skin from the back, then we will put a stitches, then that will heal like a one scar in the donor area and except in the occipital area. Next slide, please. Nowadays, rather than doing a strip technique, we can go for the FE technique, which is called follicular extraction technique. So you can see in this patient, he has a persistent frontal baldness. The mid scalp and vertex is thinned out. In that area, I did transplantation. Next slide, please. So here, rather than cutting, rather than taking out a straight, we will take out each follicular unit separately. We have a punches, we have a machine. So the machine will rotate and they will go inside up to particular depth, and they will come back and they will take out the one follicle completely. So it is a time-taking procedure. It will take 6 to 8 hours, and we have to take out each follicle separately. Then you can see white scar, white dot is there in the lower back area. That is the follicular area. It is like a small tiny white dots. They are the scars, tiny scars. Next slide, please. Next slide, please. So this is the eyebrow transplantation. Those who are suffering with the thin eyebrows, those who don't have any eyebrows, but then yes, we can do eyebrow also. We can take out the hair from the scalp, and then we can put over the eyebrow area. So it is also absolutely normal and nature. So there is no need of any maintenance. Next slide, please. And those who have this tendency, this is called keloid. So these people better not to go for transplant. Next slide, please. And the people who has the see, this is almost like grade 6, 7, and grade 8. So these people are very poor candidate for hair transplantation. So for them, we won't do the transplant from the scalp. But if they have the very good, if they have the good body hair or beard hair, yes, we can do combination of both beard, body, and scalp also in these patients. Next slide, please. Yeah. Thank you.